So Simon, what do cancer patients need to know about recognizing the signs and symptoms of blood clots? And back to basics, what is a blood clot?
In a healthy person, a blood clot is a normal part of our healing process. If I were to cut myself now and I didn't have a blood clotting system, I would just bleed to death. So our body can form a compound of blood cells and string called fibrin, which actually blocks off the bleeding. That's called a clot. Now, as good as the body is at making blood clots, it's also very good at reabsorbing them.
Absolutely.
Which makes sense, because I've been on this planet 46 years, and if every time I cut myself or knocked myself I had a blood clot which didn't go away, I'd be one big walking clot by now. But sometimes this balance of making a blood clot and reabsorbing it goes awry. And there are certain things that can make the blood more sticky and more likely to develop. In particular, things like cancer can make the blood release molecules which make you more sticky and more likely to develop a clot, often in the legs.
Okay.
And we find that you could get a clot which is in the legs and it gets bigger and it blocks blood flow in the veins. And that then can cause pain and swelling. It's a bit like if there's a crash on the freeway and there are all these cars in a pile-up, and that's the clot. And the flow of the other cars can't get through because the clots, or these cars, are stopping them moving. And over time, as more cars try and join the freeway, it gets congested. All the tributary roads get backed up.
Absolutely.
So what then happens is, if we give medicine to treat that clot, it's a bit like freeing up one lane of the clot, of the highway, and then freeing up another. But you've still got a backlog, so that swelling is going to be there. Now, if you didn't clear that highway, the whole place would come to a standstill. It'd become very dangerous. And in the real world, a clot in the leg can get bigger and it can break off. And it could go through the bloodstream up onto the lung. And that could block blood flow through the lungs, which stops the body picking up oxygen, can make you breathless, and if large enough, could cause death.
What is cancer-associated thrombosis and what are the concerns with healthcare?
Well, I know as a patient who's experienced venous thromboembolism, you know a lot about blood clots.
Absolutely.
And this is pretty much the same thing, but it is something which happens when people have cancer.
Okay.
Why is it serious? Well, for all the same reasons as someone who has a blood clot without cancer, that it can cause pain, it can cause discomfort, and untreated, it can sadly kill you.
Tell us why certain cancer patients are prone to clotting. Are there health risks for some versus others?
Absolutely. I think all cancer patients have an increased risk of blood clots compared to the general population.
Yeah.
And that's primarily because the tumour releases molecules into the blood which can make the blood more sticky.
Okay.
But not all cancers are the same. We will find that someone with cancer of the brain, of the pancreas, of the lung, of the ovaries, their blood is more sticky than someone with breast cancer or prostate cancer. But it's not just the type of cancer, it's the stage. So if you have a cancer that has spread to other parts of the body, and we call that metastases, that can increase the risk of blood clots 19-fold. Then, if we add in treatments like chemotherapy, that will increase the risk further. So if I illustrate it, someone with breast cancer, which may not be a particularly thrombotic or clotty condition, if you have someone who's had early stage breast cancer, no spread of tumour, and they're having no chemotherapy, the risk of blood clots is 0.2%. But if you give them curative chemotherapy, the risk goes up tenfold to 2%. In that same group of patients, if they had metastases, so the cancer has spread and you gave them chemotherapy, the risk was 8%.
Wow.
So one size does not fit all.
Yeah.
It depends on the tumour, the stage, the chemotherapy, and of course any other illnesses they have which may increase the risk as well.
That's very interesting.